Third step is going to be palpable edema. We're going to do our static palpation. This is mainly, again, to find things that are going to tell me about areas where there's nerve interference in the spine. So for the cervical spine, I'll put one finger in the center. I'm going to glide up. And that's where it gets boggy. It's sort of squishy and soft right there. Either direction I go, it's stopping right there by the mark. So there's some edema right there. I can press on the tips of these, of the spinuses. Any tenderness on those? Like that one right there? Okay, so he's got tenderness right there. That's pain on pressure. I'm not worried too much about the musculature out here for what we're looking for right now. For doing the thoracic spine, I like to glide down. I'm going down the right side of the spinuses. You can see there's edema right there. It's just bogging me down. It's like driving off the pavement into the mud right there. Okay, so I've got edema there. If I press, I'm guessing I'm going to have tenderness on one of these guys. Yeah, right, tenderness right there. Okay, tip of the spinous. Glide on down the spine. There's some more edema. Hey, there's a mark right there too. How about that? And we'll do the same thing. Pain on pressure in that area. And we'll glide on down, and there's the edema starts there, coming up from the bottom. So it actually is this whole area. My mark may be just a little bit low, but it's right in there. And we'll check for pain on pressure there. Now when we get to the SIs in a minute, once I know whether I have the right or left side, I can palpate those, top, middle, and bottom, and look for tenderness. If the top is tender, we're thinking possibly a PI. If the bottom's tender, maybe an AS. If the whole thing is tender, an EX. And if I don't find tenderness on it, I might suspect an IN, especially if the patient complains of deep inguinal pain. So that's static palp.